Dear Chairman, dear ladies and gentlemen, it's a great privilege to be here and honor and to start the STAR Symposium. And my topic is natriuretic peptides in septic shock. This one? That's green one. Yes, thank you. So it is very interesting that prohormones in septic shock these are robust synthesis of prohormones, like natriuretic peptides, like calcitonin, it is also prohormone, prolactin, and even proadrenomedulin, and many others are significantly increased their secretion in very early, in the acute state. Focus our attention on the prohormones of the natriuretic peptides. They are stimulated especially by the stretch of atrium and ventricles and volume overload. It is well known for others, so acute and chronic heart failure. But also this prohormone is stimulated by angiotensin 2, these are endothelin 1, growth factors, cytokines, and even by high activity of the sympathetic nervous system. You see the biological functions of natriuretic peptides. Look especially on the endocrine effects in the blue. Natriuretic peptides are focused to do natriuresis, maintain diuresis, vasorelaxation. They inhibit renin-angiotensin and aldosterone system, and sympathetic nervous system is opposite action. And they, of course, regulate blood volume and blood pressure. All we know that natriuretic peptides are associated with acute chronic heart failure. But first group who focused attention on the severe sepsis and septic shock were the German group. It is a Christian Puttensen group and leading by Martina Bruckmann. And they published 20 years ago in Circulation prognostic value of plasma and terminal pro-brain natriuretic peptides that were very high concentration. They compared the survivors and non-survivors. It was not a big group, about near 60 patients. 41 survive and 16 patients non-survive. And you see significant concentration of non-survivors. And they even found the cutoff value, 1,400 picomole per liter. And you see clearly difference of survival in hospital mortality. Since that, many papers, many trials were done on the usefulness of natriuretic peptide, especially prohormone brain natriuretic peptide as a prognostic factor in severe sepsis and septic shock. This is one of the last one, published last year by Korean. And you see here it was a quite big trial on 418 patients, 111 died. And even they compared the risk of the death associated with the level, the concentration of natriuretic peptides. And they found values for NT-proBNP more than 2,600 nanogram per milliliter. They compare many biomarkers for septic shock, and they found the best receiver operating characteristics are for lactate, on the right side, NT-proBNP and blood urea. And they suggested that especially the combination NT-proBNP plus lactate or NT-proBNP plus blood urea are the best for prediction of the death in patients with septic shock. So many papers, so there are also systematic reviews and meta-analysis. This is one meta-analysis from the year 2020. These authors analyzed 35 observational studies, and they included 3,500 patients with severe sepsis and septic shock, and they found out the cutoff value for brain natriuretic peptide 620 picogram per milliliter, and for NT-proBNP it was the cutoff value to discriminate mortality to be 4,000 picogram per milliliter. So they try to find, by meta-analysis, the optimal cutoff value. The second big meta-analysis was done last year, 2024, brain natriuretic peptides as a predictive marker of mortality in sepsis. It was also a huge meta-analysis, and they found out the cutoff value for brain natriuretic peptide should be between 400 to 800 picogram per milliliter, or in cutoff values for natriuretic peptides, 3,000 to 6,000 picogram per milliliter, to be associated with death due to septic shock. Of course, they found that these parameters had only moderate prognostic value in predicting mortality. Look on the conclusions with sepsis. And this is only for establishing appropriate cutoff values is very difficult because there are huge variability of the values in thousand, between 1,000 up to the 35,000 picogram per milliliter regarding natriuretic peptides. Also, we did a prospective study last year in our Department of Anesthesiology in Intensive Medicine. We follow up the prohormones, proadrenomedulin, MR, and natriuretic peptide, brain natriuretic peptide, and we compared two groups, patient with septic shock, 12 ICU patients with septic shock, and 12 patients critically ill with high advanced multi-organ dysfunction after multiple trauma, craniotrauma, resection of esophagus. You see that there are no differences in age regarding mortality was the 17%, and you see here that there is significant difference regarding proadrenomedulin. 1 nanomole per liter is a median in severe SARS after trauma, but 5.8, nearly 6 times higher for septic shock. And looking onto NT-proBNP, yes, much significant, nearly 100 times to 1,000 times higher concentration of natriuretic peptides of brain, pro-brain in the case of septic shock. You see even here other parameters. This is our study looking at other biomarkers of inflammation and critical illness. First, 3 ICU days. You see very high values of neutrophil lymphocyte ratio, double times when compare septic shock with severe sepsis. Procalcitonin is 20 times higher when compared with severe SARS. And of course, NT-proBNP, very significant difference when compared to critical illness. Septic shock is much higher, and also proadrenomedulin. Interesting is a look on the troponin, the heart injury, because troponin are elevated like in sepsis and septic shock, but not so much to correlate with NT-proBNP. So it is also the evidence that a very high NT-proBNP is not only the matter of the myocardial dysfunction, myocardial injury. Look also on CRP, so evidence of the differences between septic shock. So what is the analysis? So why is so high? And this is few hypotheses, few attacks. So why NT-proBNP is so high in septic shock? First is cytokine storm. Cytokines may stimulate, like TNF-alpha, interleukin-1 and 6, stimulate synthesis of NT-proBNP. The second one is endocrine storm, stress due to septic shock. And you see the acute elevation of many prohormones written here. Of course, even there is some contribution of the heart failure, sepsis-associated cardiomyopathy. And of course, there is a very strong evidence that an NT-proBNP is a system for counter-regulation of very high plasma renin activity and overstimulation of renin-angiotensin-aldosterone system in the shock state. Of course, there are other reasons, and other causes like hypervolemia, fluid overload. When we give too much fluids, in resuscitation, and even it is a marker of endothelial injury and glycocalyx. This is the paper published this year by my friend and our friends, we can say, Roman Kula from Ostrava, understanding the role of NT-proBNP in septic shock beyond cardiac dysfunction. He also emphasized that not only cardiac dysfunction is responsible for this. He did you see the graph on the left side, and they compare the association and the correlation between high NT-proBNP levels with the concentration of the albumin. It is on the left side down, left corner. It is, you see very clearly the negative correlation, and positive correlation is on the upper graph. This correlation between NT-proBNP, but in logarithms, because there is a huge variability, with the so-called modified capillary leak index. It is the ratio between C reactive protein divided by concentration of albumin, CAR. It is the shortage of this. So it is a modified capillary leak syndrome. And they put a hypothesis that NT-proBNP is also the marker of endothelial injury, capillary leak, and glycocalyx disruption. And it is also confirmed by other paper. You see it on the right side. Natriuretic peptides increase production, decrease degradation. And you see even here where they act, NT-proBNP on the heart. You see antimitogenic effect, ventricular remodeling on the kidney. They try to maintain natriuresis and diuresis in case of shock state. And there is a strong antagonism of renin-angiotensin aldosterone. And on the vasculature, as you see, there is a marker of endothelial and glycocalyx disruption. Back to the physiology. It is very old paper, 25 years ago. Sladen and Donald Landry in anesthesiology clinics of North America, they published all about kidney, renal blood flow regulation, autoregulation, and vasomotor nephropathy. And look on the blue arrows. I would like to read it, yes. And natriuretic peptides provide a competitive block of norepinephrine. There is a competition against sympathetic nervous system. Non-competitive block of angiotensin II, and reverses their vasoconstrictor effects. It also antagonizes the renin-angiotensin aldosterone axis at multiple sites. It inhibits renin release, aldosterone release, angiotensin II, and salt-retaining action of aldosterone. So NT-proBNP are the hormones with natriuretic peptides which block overstimulated, very high renin activity. So it is confirmed by also this paper on few hundreds patients with acute heart failure, implemented incremental predictive value of plasma, renin activity, and NT-proBNP. Look on the graph on the right side, and the lowest mortality rate had a patient with a low NT-proBNP concentration and with low plasma renin activity. Opposite the blue line, yes, on the bottom, highest mortality, patient with high NT-proBNP levels and very high plasma renin activity. This paper was issued just this year, 2025, by Speranza Rubatu from Italy. They are specialists on the brain natriuretic peptides. They concentrate on the research 20 years. And the article is excellent, balance between natriuretic peptides and renin-angiotensin aldosterone system activity. Yes, and they conclude that there are many, many relationships. Of course, the relationship is not so simple, not linear. There are some non-linearities. Many other factors are playing the role, so we can conclude very simple. But they said that there is a maladaptation of the renin-angiotensin aldosterone system in the critical illness, and there is a counter-regulatory action of the NT-proBNP activity, so brain natriuretic peptide and ANP as well. So here again the same we see on the left side especially. Look on the endocrine effects. Natriuretic peptides, the main goal is natriuresis, maintain diuresis, vasorelaxation, especially in the glomeruli, inhibition of renin-angiotensin-aldosterone system, there is antagonism of sympathetic nervous system and to regulate blood volume. Also, there are many paracrine and autocrine effects. On the green, you see here how many very positive effects have natriuretic peptides. So it is something like protective system in case of critical illness. And when there is a high, it means that there is a high endocrine storm, and they would like to counteract against this. So we are coming to the end, conclusion. NT-proBNP is a reliable marker for septic shock and sepsis in general. It is a marker of cardiovascular instability and dysfunction together with renal dysfunction in critical illness. Their concentration are significantly elevated, 10, 50 to 100 times. They should be measured in natural or decadic logarithm. Very high values, over 3,000, 4,000, are associated with the worst clinical outcome and bad prognosis. The pathophysiology of NTB secretion are not fully understood. Of course, well-known walls, myocardial stretching, left ventricle, right ventricle are well-known, but even the high values are the consequence of systemic inflammation, sepsis, pro-inflammatory cytokines, endocrine storm, stress, overactivity of sympathetic nervous system, endothelin and angiotensin II action. NT-proBNP, so natriuretic peptides, do counter-regulation against overshoot of renin-angiotensin-aldosterone activation, inhibit renin activity, angiotensin II activity, and aldosterone, and protect organs, especially kidney, and maintain their function. It is also the marker of endothelial glycocalyx injury and capillary leak syndrome. And this is a like. Thank you so much for attention. And take one message: monitor NT-proBNP in septic shock and in critical illness, at least at the very beginning, first days, and analyze it and think why. That's a question. Thank you so much.